discuss what is it. See, a Parkinson's disease is a disorder of the central nervous system. Central nervous system means your brain and the spinal cord. Okay, so that affects the movements, often including the tremors. Clear? So we can say Parkinson's disease is a disorder of central nervous system that affects the movements, often including tremors. Clear? Or you can say it is a progressive disorder of the central nervous system marked by the muscle tremors, muscle rigidity, decreased mobility, stooped posture and slow voluntary movements, and a mask-like facial expression. Clear? So this Parkinson's is a condition, and this condition is named after James Parkinson, who in 1870 described the shaking palsy as a Parkinson's. What is it? It is a chronic progressive disorder that affects the nervous system and the parts of the body controlled by the nerves. Clear? What actually happens in this disease? Let's discuss. See, the nerve cell damage in the brain causes the dopamine levels to drop, leading to the symptoms of Parkinson's. Let's discuss. See, Parkinson's disease is a degenerative disease caused by the depletion of the dopamine, which interferes with the inhibition of the excitatory impulses. So the Parkinson's disease results in a dysfunction of the extrapyramidal system. Parkinson's disease is a slow, progressive disease that results in a crippling disability, as you can see here. The debilitation can result in falls, self-care deficits, failure of the body system and depression. Mental deterioration occurs late in this disease, as you can see here. Next, we will discuss about its assessment, how you can assess this disease. What are the symptoms? First is Bradykinesia. What is Bradykinesia? Bradykinesia means abnormal slowness of the movement, and we can say is the one of the cardinal manifestation of the Parkinson's disease. This Bradykinesia is the abnormal slowness of the movement and the sluggishness of the physical and mental responses. Next is Akinesia. A means absence, kinesia means movement, absence of movement, or you can say loss of ability to move your muscle voluntarily, like freezing like gait will be there in this Akinesia. Next is monotonous speech. Monotonous speech means mono means single, tone, tonus means tone. So single tone without harmony or variation in a pitch. When someone speaks in a monotone, his voice is flat and boring, you can see. Okay. Next is handwriting that becomes progressively smaller in this disease. Tremors in the hands and the fingers at rest. Here you can see in this image, there will be a typical pill rolling tremors of Parkinson's disease will be there, like pill rolling tremors. The tremors in the hands and fingers. Then is tremors increasing when fatigued and decreasing with purposeful activity or sleep. Next is rigidity with the jerky interrupted movements. Restlessness will be there, pacing. Blank facial expression, that means mask-like faces will be there. Here you can see in this image what will be the symptoms of this Parkinson's disease. There will be stoop posture, back rigidity will be there, flexed elbow and the wrists, tremors in the legs, shuffling short stepped gait will be there, slightly flexed hip and knees, hand tremors will be there, the typical hand tremors including your pill rolling as we discussed in this image, reduced arm swing, forward tilt of the trunk, and typical is, as we discussed, blank facial expression will be there, mask-like faces will be there in this Parkinson's disease. Next, drooling. Drooling means drop the flow of saliva or a drop saliva. uncontrollably from the mouth. So next is difficulty swallowing. Difficulty swallowing, you all know that dysphagia will be there, difficulty in speaking will be there in this disease, loss of coordination and balance, shuffling steps will be there, stooped position, propulsive gait. As you can see here, this image, the tremors of the hands even addressed as we discussed, pill rolling will be there, persistent tremors in the hands, shuffling, and in a small steps curved in a characteristic ways, as you can see. Next, then we have discussed about this assessment. Next we are going to discuss about its intervention, what you can do for this disease. First of all, you have to assess the neurological status of the client. Assess the ability to swallow and chew, as the patient is having dysphagia, difficulty in swallowing, so you have to assess the ability to swallow and chew. And what you have to do, you have to provide the client high calorie, high protein and high fiber diet with the small frequent feedings. You have to increase the fluid intake of the client to 2000 ml per day. Monitor for constipation. Promote independence along with the safety measures. Avoid rushing the client with activities. Assist with ambulance and provide assistive movement. Next, instruct the client to wear low-heeled shoes. Encourage the client to lift feet when walking and to avoid prolonged sitting. Provide a firm mattress and position the client prone without a pillow. Why? To facilitate proper posture. Instruct the client in proper posture by teaching the client to hold the hands behind the back. Why? To keep the spine and the neck erect. Promote physical therapy and rehabilitation. Administer anticholinergic medications as prescribed to treat tremors and rigidity and to inhibit the action of acetylcholine. Administer anti-Parkinson's medications to increase the level of dopamine in the central nervous system. Clear? Next, instruct the client to avoid the food high in vitamin B2. The vitamin B2 rich foods are like your dairy food, dairy milk, yogurts, cheese, eggs, chicken, salmon. As you can see here, the cereals, whole and enriched grains, milk, milk products, oysters, spinach, cheese, mushroom, broccoli, eggs, chicken, meats, etc. So these foods having the vitamin B2. So you have to avoid this food. Instruct the client to avoid these foods. Why? Because these foods block the effect of anti-Parkinson's medications. Instruct the client to avoid the monoamine oxidase inhibitors. Why? Because they will precipitate hypertensive crisis. Clear? So this is all about the interventions. So today we have discussed about Parkinson's disease, its assessment, how you can assess what are the symptoms of this disease and what are the intervention, what you can do for this disease. Clear? So I hope today's topic is clear to you all. Thank you. Have a good day.